I'm also very appreciative that Maree, Todd, the MSP for Caithness, Sutherland and Ross has been able to take time out today to be with us. She is the Minister of Public Health, Women's Health and Sport. She was a Minister of Children. Minister for Children. She was a hospital pharmacist, so she can relate to some of the activities that we've been doing. But it gives me great honor to welcome Maree to the stage. Maree.
Thank you very much. Gosh, well, it's lovely to welcome you all to Scotland. I have to say it's not usually this warm. Yesterday I had to attend my first, and it was the first ever, Scottish Government Resilience meeting on coping with extreme heat. So I hope you're all managing well in that. Thank you for the introduction and for inviting me to address this prestigious event today. I really enjoyed the conversations last night at dinner, and I was really pleased to meet colleagues in person. I've spoken to a lot of you virtually over the last couple of years, but it really does make a difference to see people face to face and have that face-to-face conversation. I'm delighted to have the opportunity to talk today a little bit about our approach to physical activity and sport in Scotland as a whole, and about the role that golf can play in helping us to achieve our vision of a Scotland where more people are more active more often. Now, 2022 is an unprecedented year for golf events in Scotland. For the first time, the RNA's three major championships, the Open, the Women's Open and the Senior Open, are taking place in Scotland in the same year. And I was really privileged and delighted to visit the 150th anniversary of the Open over the past week and to witness the huge crowds who attended and enjoyed that fantastic occasion. These events are really important for the Scottish economy. Golf events have generated more than £750 million in the last decade. The Open itself brings in over 100 million of benefit, financial benefit, each time it's held in Scotland. And in addition to the direct benefits, they help maintain our international reputation as the home of golf, and they boost Scotland's golf tourism industry, which pre-COVID was worth around 300 million a year. As Minister for Sport, I am delighted that sporting events are bringing these benefits to Scotland, and it's right that we should celebrate the hard work that's gone into bringing them here. But as well as being Minister for Sport, as Fiona said, I'm also Minister for Public Health and for Women's Health. And combining these roles is not an arbitrary decision. It reflects our view that as well as the other benefits to the people of Scotland, sport plays a very important role in our health. Now, Fiona's already spoken today about the World Health Organization Global Action Plan and the drivers behind it. We know that being physically active is one of the very best things that we can do for our physical, mental and social health. For example, most non-communicable diseases are the result of 4 particular behaviours: tobacco use, unhealthy diet, the harmful use of alcohol and physical inactivity. Now, the first 3 risk factors are very commonly understood. That the fourth, the role of physical inactivity, has been much less widely recognised. Now, as well as benefiting our physical health, and it's kind of obvious, isn't it, that being physically active benefits our physical health, but being physically active also benefits our psychological well-being. It helps us to sleep better, maybe not in this extreme heat, but it does help with sleep. It has really positive impacts for women's experiences of menstruation, of pregnancy, and of menopause. There's consistent evidence that physical activity can be used to treat, not just to prevent, but to treat depression and can help your cognitive function. So the Daily Mile, which I'm a passionate advocate of, they managed to show evidence that children's brain power actually grew if they were daily miling. It's worth quoting the UK Chief Medical Officers, what they said about the benefits of physical activity in the 2019 guidelines. If physical activity were a drug, we would refer to it as a miracle cure, due to the many great illnesses that it can prevent and help to treat. The Scottish Government has recognised the importance of physical activity for many years. Scotland was one of the first countries to develop a strategy to improve levels of physical activity, and we've embedded this right across government. Being active is now explicitly part of our national outcomes, and we measure our performance towards these objectives through our national indicators. Through the work of Fiona and her colleagues at the World Health Organization, they've shown important leadership in the Global Action Plan for Physical Activity. We are really pleased to receive Fiona's support for the publication of our Active Scotland Delivery Plan in 2018, with the recognition that Scotland was one of the first countries to publish a delivery plan based on the principles described in the Global Plan. Now, central to our approach, and in line with the advice of the World Health Organization, is that need for a whole system approach. We know that addressing physical inactivity isn't just solely the responsibility of the health sector or the sports sector, but it needs everyone right across society to be committed. If we are to be successful in achieving our vision of a Scotland where more people are more active more often. Now, our vision is backed by concrete action across sectors. We've developed an active travel framework, which outlines how we'll deliver that ambition by 2030. Scotland's communities are shaped around people and place, enabling walking and cycling to be the most popular mode of transport for short, everyday journeys. We continue to support children to be active through our commitment to deliver at least 2 hours of PE for pupils in primary school and at least 2 periods of PE for all pupils between secondary 1 and secondary 4. Our flagship Active Schools programme continues to provide more and higher quality opportunities to take part in sport and physical activity before school, during lunchtime and after school, and to develop effective pathways between schools and sports clubs in the local community. And of course, we have the Daily Mile. It's an initiative born in Scotland, which is now spread across the world. It's accessible to everyone, it's easy to deliver, and it's been proven to be effective. Now, I've been running a Daily Mile myself now since I first became a minister back in 2017. It takes 20 minutes out of my day, and I make time for it, and I'm a busy woman. I make time for it because it makes me feel good every day. I could waste that amount of time on Twitter and feel very bad. Running a Daily Mile takes that amount of time out of my day and makes me feel good. Why wouldn't I want to do it? And I have to say, during the course of the pandemic, that daily short run was one of the things I would say that just kept me strong. It's been a tough old time for everyone. It's been a tough time for people in sport. It's been a tough time for people in government, and it's been a tough time for everyone in health, a tough time for the nation. And that ability to have that daily 20-minute dose of endorphins, dopamines, sunshine sometimes, definitely helped. So we have an advantage in Scotland when we're promoting the benefits of things like the Daily Mile, because we've got a unique natural environment. We've a real asset in encouraging people to be active outdoors, and recognising the importance of that, we've developed a Green Health Partnership programme to build the links between health and the environment sectors, and to help health professionals understand the value of engaging with nature as a potential option in addressing physical and mental health issues. Now, these actions are only a snapshot to highlight the range of actions that we are taking forward across different sectors, and which demonstrate our whole systems approach. It has produced results. Scotland has been able to maintain the percentage of the population who are active and has even seen a slight increase. We are bucking the trend. Prior to the pandemic, the percentage of adults classed as active had risen from 67% in 2012 to 71% in 2019. Now, this achievement is testament to the work of a huge number of highly motivated and skilled people in Scotland who enable and support others to be more active more often. They include a mixture of volunteers and professionals throughout Scotland's health and social care system and in local authorities and staff in schools, care homes, leisure facilities, community groups, sports clubs, and those involved in developing cycling and walking networks. It's through the work of these individuals that we can continue to support people to get active and to stay active. However, although these achievements are worth celebrating, we know that many difficult challenges remain. Too many people still face too many barriers to participation. In 2018, our Active Scotland delivery plan, we stressed the importance of addressing these inequalities for women, for older people, for Black and ethnic minority groups, for disabled people, for LGBTI people. We recognised that more had to be done to remove the obstacles which prevent them from participating. In 2019, 4 in 10 of those living in our most deprived areas of Scotland participated in sport, compared with nearly 7 in 10 of those in our least deprived areas. Only football has a degree of reach with overall participation rates similar between areas of both high and low deprivation. Now, these are challenges that we are determined to address. A great deal of work has taken place since we launched the delivery plan. At a national level, our Changing Lives programme has successfully supported 17 partnerships, providing short-term additional resource to enable sport and community organisations to intentionally change lives through sport and physical activity. And it aims to bring about change in relation to health and well-being, inclusion skills and community connections. Funded partnerships involve collaboration with a wide range of other organisations, including community, equality, youth work and health. The programme has demonstrated the impact that we can have when we use sport and physical activity intentionally to change lives and to address barriers. And it's an ethos which has to be embedded into the culture of the sector, and Changing Lives has begun that journey. The importance of this work and a relentless focus on addressing inequality has been sharply demonstrated by the pandemic. It's clear that the impact of COVID-19 has not been felt evenly. We might all have been in the same storm, but we weren't in the same boat. The last 2 years have both highlighted the inequalities in our society, and they've made them worse. Those who were already the most disadvantaged have suffered disproportionately. They've been hardest hit socially, educationally, and economically. And the long-term impact of the pandemic on our levels of physical activity is still being understood. The evidence is complex and mixed, but it's becoming increasingly clear that as with the wider effects on our society, the impact has fallen disproportionately, both exposing and amplifying inequalities. There is, for example, a consistent evidence for a widening of inequalities between people of white British ethnicity and Black and Asian ethnicities. There's emerging evidence that teenagers have become less active, as have people in our more deprived communities. And equally, while the evidence of the impact of COVID on physical activity of older people varies, any decrease on the low pre-pandemic baseline levels of older adults is of significant concern. Some projections suggest an annual 4% increase in falls as a result of deconditioning, which has occurred during the pandemic. The consequences of a severe fall for an older adult can be devastating, and this level of increase will place many more older adults at risk, as well as creating a significant burden on our health and social care system. So this all serves to reinforce the importance of ensuring that addressing inequalities is absolutely at the forefront of our minds. Sport Scotland are in the final stages of developing their new equality, diversity and inclusion approach that will build on their current work and inclusion with groups such as women and girls, those with a disability and those living in poverty. Now, I know that golf as a sport is already closely engaged with this agenda, and it is really encouraging to see the work that's being taken forward. Scottish Golf's vision and strategic framework makes it clear that it aims to support everyone to enjoy the benefits of golf and to promote sports equality to the highest standard. Now, I know that Scottish Golf has signed up to the LGBT Sports Charter and is working to understand the challenges faced by disabled people and those with mental health issues to participation. As we focus on increasing participation by women and girls in physical activity and sport, it's really good to see that Scottish Golf is also working hard to drive greater women and girls' engagement in the game. Work to remove the barriers, to embed the ethos of intentionality and to broaden the participation base. These have to be the priorities as we move forward from the worst of the pandemic. Our recovery must be about how we make life better for people. It can't be about how we get life back to the way it was before. Because for too many of our citizens, that isn't good enough. The fact that we're all here today at a congress on golf and health demonstrates that the sector recognises the role it can play in achieving these aims. Looking at the programme, I see a very impressive range of international speakers with invaluable knowledge and experience to share. And I'm really grateful to the RNA, and in particular, Dr. Andrew Maree, for putting together what I am sure will be a valuable and instructive event. I'm looking forward to listening and learning today and hearing more about how golf can help us to address the challenges that we face. Thank you.